Well, I'm Ashley Hendricks. I am from Brookings, South Dakota, and I work for the Special Education Department at the Brookings School District. Bo was 3 months old at the time. He's currently 19 months old. And when this all occurred, he had been showing your typical cold symptoms for a 3-month-old baby. He had congestion, on and off fever, and I took him in and was like, this is his first ear infection. And they were like, nope, his ears are fine. And so they just assumed that it was a viral infection, and we just continued to monitor, and like a typical cold for a 3-month-old baby. And it wasn't. We had been into the clinic a couple times, and I finally on Saturday morning just said, something's wrong. He had cried for 8 hours straight on Friday night and started running a fever. And so brought him into the clinic, and they just ultimately said, we can run the basics, but you really need a comprehensive evaluation for Bo. And so we're gonna send you over to the emergency department over at the Brookings Health System. When we arrived, Bo and myself arrived to the emergency department on Saturday morning coming from the Sanford Clinic. And the minute we walked in, they knew we were coming. It was amazing that the clinic was like, we will call and let them know you're on your way. So from the minute we walked in, we got checked in, and then we were back into the room within 5 minutes, and the nursing staff was ready to be there. The ER staff was phenomenal. Walking into an ER, you just never know as mom what you're going to get. And I was so nervous when a clinic can't answer your questions and they send you to the ER, you're going, okay, deep breath, what are we gonna find out here when we go? And the minute, we had 2 amazing nurses, Ashley and Heidi, and I forever will be grateful for them. They immediately comforted us and started working and gave Bo what he needed in the moment, and then proceeded from there to give us the care. So when we arrived at the ER and they continued to do all of the things, Bo was originally diagnosed with rhinoenterovirus. And they sound really scary in the moment, but it's ultimately, they explained it to us as a cold. I was like, I knew that was that. But he was still so lethargic and just not eating and not responding to anybody in the care room. And so my mom gut told me that something more was wrong than just a viral infection. And Nurse Heidi came in and she was amazing. She goes, my mom gut's also telling me that there's something more with this. And so my nursing gut is also telling me that there's something more going on. And so they went out and consulted with the doctor again and ended up doing another test. And it was kind of a newer test, but it ultimately indicated that he had a bacterial infection, but it was unknown where or why it was happening to him. And so from there, they continued to monitor and tried to get to the source of it, and Bo was eventually diagnosed with bacterial meningitis. At the time going through my mind when they say bacterial infection, you immediately get on Google because that's what everyone does. And it was like a range of you're fine to death. And you really have no idea what you're working with. And so that was the most difficult to comprehend of, well, what's next? So the ultimate decision from the emergency department was that they needed Bo to be monitored because we didn't know which direction he was headed. And so they gave us the choice to be monitored here or be monitored down in Sioux Falls at the Children's Castle, and that's ultimately where we ended up due to the need of such intense pediatric care. The Brookings Emergency Department shared everything for us in ways that we could understand. I joked with them, I'm in special education, I need you to talk to me like I was just a person off the street. I don't want your medical terms, and they were fantastic, especially when they said rhinoenterovirus. I was like, what is that? And I, from there, was like, I don't know what rhinoenterovirus is, and they're like, it's just a cold. Okay, that's a lot better to understand. And so they really just talked to me like I was a person that had no medical experience, which was amazing because when you see lab reports of all of the things, as mom, I was already panicked. I couldn't interpret anything that they were giving me. So they really broke it down to level of understanding for me. Sanford Clinic in Brookings here and the Brookings Health Emergency Department communicated fantastically. The clinic was able to call the ER They were ready for us, and so that communication was great. And then once we decided to go from the emergency department here in Brookings down to the Sanford Castle, the communication was also amazing. We ended up driving ourselves down instead of doing an ambulance because Bo was pretty stable at the time. And so once we arrived there, they knew who we were, where we were coming from, and got us into a room down there really quickly. And then they were able to communicate back here and say, oh, these are the tests that you've already have done. This is where you're sitting, and how do we move forward? And so the communication was amazing between the two facilities in different cities. The thing I appreciated the most about my son's care here in Brookings were the nurses. Bo had the most amazing nursing staff that I have ever come upon, and after having 2 kids, I will never have better nursing. Heidi and Ashley went above and beyond and really just treated me like a mom that was worried, and treated Bo like he was their own son at 3 months old, and really worked to get an answer. And they continued to reach out once we had the diagnosis in Sioux Falls, and just checked in with my family and our support system, as they knew it was really significant, and just their care was outstanding. The nurses' advocacy was so important to us. Heidi and Ashley really just continued to work when we knew we had some answers, but we didn't know what for sure. And so I just kept saying, my mom gut tells me there's more. And they were like, okay, we'll keep working, and we'll keep trying to work to find answers. And so they continued to go back to the doctor and just kept pushing, like, mom is saying there's more, this is abnormal. And so it was just a really strong line of communication when I have no medical background. If the Brookings ER wasn't here to help us in this situation, my son might not be here today and be the strong, happy 19-month-old that he is able to be. Their care and commitment and trying to find us an answer, and then ultimately being able to send us where we needed to go, is what kept him alive and here today. So right now, Bo has no significant side effects that we are noticing, but we just continue to monitor him. I would recommend Brookings Health System to others in our community, as they are a facility that is there for you no matter what time of day, whether it's trauma or just a significant sudden illness. They were able to support us when we didn't know what was going on, and so for our community, it's an amazing resource to use, and they are willing to send you and find you answers to whatever you might need.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.